My name is Otieno Moses, registered nurse. I work for Farm Access Foundation. I'm a project manager for Mom Care program that is run in Kenya and Tanzania. So I'll give you a very brief introduction about it. And it's aligning to Dr. George Kimathi on the digital ICT tools that we're using. So Mom Care is a digital enabled care pregnancy care model, leveraging digital technology to empower pregnant women towards maternal and neonatal health outcomes. This is a photo that we took at Kombewa with one of our partners here. And this baby, this mother had lost 4 babies, so this was a precious baby for her. 2 of the babies, I think, were lost during referrals. So once we renovated the theater at Kombewa, we were able to rescue this baby and have a prompt CS done. So I'll go just direct to the objective that I won't just go into the details, but you can see the right side and the left side. Kenya and Tanzania, we have very bad maternal outcomes. 342, and Tanzania has 524 maternal deaths. And when these mothers have high risk, we have a lot of expensive mothers across the journeys. So what we're trying to do as Mom Care is reduce this spending power of the mothers, especially more to the teenagers, because most of our mothers, I think 80% are Linda Mama or NHIF, which does not cover for all the costs. So I won't go into this detail because I've explained it. So this is how we work. We have a wallet. We also based on quality and transparency. So in wallets, this is where the mother pays, or you have an insurance, or you have a donor who pays for it. In quality, I think for GOK we use the KQH model, but for safe care, for Mom Care we use the safe care model. And for transparency, we create a visibility of access to these quality journeys and have an action to the gaps, and also do the care analytics to show equality in gaps, root cause analysis, and predictions. So basically, we draw a smart contract that is embedded on technology like blockchain. So for example, you'll have a contract that says if you have PPH and don't see TXA, do not execute. But it's a digital contract. And I think Emily can attest, for example, if you don't see some procedures that are done in a patient, we decline to pay that invoice. So all this is all digitally run. We have a program that has AI to see these journeys across board and be able to execute the same. So currently, this is what we are having. We are in 28 facilities across Kenya, and 20 facilities are in the Western region. We are in 2 GOK facilities in Kisumu, and I think 1 in Kakamega. We have already reached 28,000 mothers enrolled into the program. This is our adherence to skill delivery. And out of this, we have 55% of these mothers which are high risk. So have high burden mothers. The system has a way to rate the facility on the journeys and give a score, a rating score between 0 and 5. So you can see 45% of the mothers have a journey score above 3.5. Just like the hotel ratings, want to go to a 3-star or 5-star. So any journey that's above 3.5 is a well-executed journey. You also control the cost. You can see our average cost for those mothers are about 100 euros. And for all good journeys that have a score above 3.5, we reimburse a bonus through the system to the providers. So you can only see 29% of the mothers who have unlocked the bonus. So meaning that our journeys are still not at optimum. We need it to be 100%. 48% of our mothers are having more than 4 NC visits. And this system, and this system, it doesn't only check on the number of NCs, but timely NCs. So this is one of the contracts that we have. It's just the normal contract with WHO and Kenyan guidelines. It's nothing new. We also have reminders to the mothers because we want to track on patient-reported outcomes and measures. So this is how the contract looks like. And now this contract is made digital. For the mothers, this is how we support during the care process. We do reminders at enrollment, when they come for reviews. We also do the birth plans, reminders, deliveries, immunization, and also end of the journey calls. These are the touch points that we also follow up. Timely enrollment. We want mothers to enroll at first trimester. Timely reviews, that is timely 4NC visits at the correct time. Test and treat. We also, the system checks on the how effective are you treating those patients who are high risk. The birth plans, kit deliveries, and cesarean section rate. And also evaluate this per the WHO guideline. So your CS rates are supposed to be between 10 and 15%. Also on the outcomes. So if the facility has extra bad outcomes, so the Journey score goes lower, and we rate these facilities per Journey scores. So you can see I have blurred the providers here. This is an example of how we rate them. The highest facility is at 3.0, and we have others at 0.9. So any facility that's below 2 is relegated from the program because they're not offering quality journeys. So they have to strive to have better outcomes. So this is also a preview of how we support the nurses and the midwives, so they can be able to see the process of the mothers using their phones. So all this data that is built goes back to their phones, and they can be able to see the journeys and also see the gaps. For example, they have only one ANC, missed dexamethasone, and also missed 2 PNC. Because the current week is at 46, the patient did not come for PNC. Another example, can also see how patients are moving from one facility to the other, and show the gaps across board. These are sample dashboards that we use. We empower this for the providers, and the patient journey app we empower the midwives. I don't think I have another thing. Thank you for your listening ears.